Today's TMJ4.
Welcome back to the Morning Blend. Well, there are 90 million chronic snorers in America, and get this, 80% of couples, so 8 out of 10 couples with a snoring partner, sleep in separate beds. Snoring does not add up to a good night's sleep, so today helps so that you can get your Z's.
Yeah, Dr. Madan Kandula is a board-certified ear, nose, and throat surgeon with Advent. Welcome back, doctor.
Thank you. Thank you.
Nice to have you.
Thanks for being here. You know, when we look at some of those numbers, I think that's staggering. You think of all those people, all that percentage of people.
Right.
How many of those people just snore, and how many suffer from something like sleep apnea?
About 20% suffer from sleep apnea, so 80% are snorers. And we always say, well, they're just snorers. But that just snore, that 80%, that's, I mean, it really, to the person next to the snorer, whether they're snoring or whether they have sleep apnea, it really doesn't matter. I mean, it's as annoying either way.
It's like, I don't care if it's going to kill you
right, exactly.
or not, it's still bugging
Absolutely.
me.
Yep.
Yeah.
So, you know, that 20-80, yeah, okay, whatever. But if you really think about those numbers, that's big time. I mean, I really can't think of any other issue that would separate couples like snoring does, and it's something that through the ages there have been lots of things coming after it. Nowadays we've got really good treatments coming after both snoring and sleep apnea.
Well, and I wonder, speaking of the difference with those two, we know that there are serious medical consequences of having sleep apnea, especially if you're not having it treated. What if you're just a chronic snorer? Can that be bad for your health too?
Yeah, it's not deadly like sleep apnea is, but it's definitely, you know, it's just a drag. It's a drag not being able to sleep properly every night. Even for the snorer, lots of folks come in and they say, well, you know, it's snoring, it doesn't bug me, it bugs my wife or my husband or whatever. But it does bug you. I mean, so typically when we're able to flip that, when we're able to treat that and correct it, almost everybody notices, well, yeah, I thought it was just affecting, you know, my spouse or my partner, but really I'm sleeping a lot better these days. I'm feeling better. I'm feeling more refreshed. I'm feeling, you know, just more like myself.
How do you determine which one you have, sleep apnea or if you snore?
Sometimes I can tell based on somebody's history, you know, what are they telling me, how tired are they, those sorts of things, based on their anatomy. So when I look in their nose, look in their throat, I can kind of see and gauge, you know, how big of a problem is this going to be. But really the only way to know for sure is to do a sleep study, which is a pretty low-key thing nowadays. So it used to be you had to go to sleep lab and get that done. Nowadays we have this little device, which is just a home sleep study. So that's it. I mean, that's literally.
It looks a lot easier than what you think of being hooked up to all these electrodes.
It's a whole lot easier. It's in your own bed. You just basically put it on. It's just like a head strap you put on. You go to sleep. You bring it back the next day. We just download the information. That's it.
Is it pretty accurate?
It's very accurate. So it's pretty much the same information that we're getting on a true sleep study. It tells us if you're snoring, how much you're snoring, you know, how loud, what percentage of the night you're snoring. If you have sleep apnea, it tells us the same things. How many pauses are you having? How significant? How low does your oxygen level? How low do they go? And really kind of quantifies the situation. With that, then we can kind of figure out, okay, where are we going from there?
I wonder too about, you know, we talked about couples, you know, 8 out of 10 sleeping in separate beds because of snoring. I bet you hear some of that.
Yeah, absolutely.
You probably feel a little bit like a marriage counselor.
I'm not a counselor, so I get to get out early in that phase. But it definitely, absolutely. I mean, and people, same thing like I was saying with snoring, people kind of minimize it, say, oh, you know, it's just snoring, but it really affects you. I mean, it's a nightly, every single night there's a wedge that's getting driven between you and the person that you love, and it makes you, the other person, less lovable. I mean, it just does. There's nothing good about it. It's annoying. It's a nuisance, and it just happens every night. And it's also sort of at your worst time of the day when your defenses are down. Everybody just wants to get a good night's sleep, and all of a sudden, the person that you love is the one that's not allowing you to do that.
Right. Yeah. I remember talking about when when Katie Holmes and Tom Cruise were married. They slept not only in separate rooms but on separate sides of their home, which was huge. So I mean, it's a big thing.
Was that because of snoring?
Yeah.
Okay.
At least that was what they said in all the publicized reports.
Why do you think people don't get treated?
Fear. I think a lot of folks are fear and denial, those two things. So either folks just don't know, they don't know, well, what's going to happen, what's going to go on when I go in to get it checked out, or, you know, I don't really have a problem. It's, you know, it's not so bad. But both of those things they're not valid. I mean, there's nothing to getting checked out, and we've got good treatments these days. There's nothing to be fearful about.
Well, yeah, talk about how you treat it, and does insurance ever pay for it?
So insurance will typically cover the evaluation, because in the evaluation stage, we're figuring out whether somebody has sleep apnea or snoring. If somebody has sleep apnea, there's many treatment options for those folks. If somebody is just a snorer, then we've got many treatment options for those folks. Typically, though, if somebody's just snoring without the sleep apnea, insurance usually doesn't cover treatment for those issues, but they tend to be very reasonable, and they tend to be very effective these days.
If you have to do any procedures, does that require people to be out of work or school for a long time?
Typically not. The most common procedure we would do for somebody who has just snoring is something called a pillar procedure, which is where we put implants in the back of the throat. That's something we just do in the office under local anesthesia. This is kind of just a diagram of what that looks like. Very easy, very low key. You can come in on your own, you go out on your own. It's kind of like getting a filling done where it's numb. If something feels, it feels like something happened back there, but you're good to go. And it tends to be very effective for snores. About 80 to 90% of snores, if we're doing the pillar procedure on them, it resolves that issue.
And is it somewhat permanent, or is it
It's
wow,
permanent. So the
that's
implants stay in
incredible.
forever, and the effects stay forever.
Really quickly, what's the most important question people should ask themselves if they snore?
The simplest thing is why not take action? Why don't you? Why are you not doing something about it? Why don't you just figure it out and get some help?
Yeah.
Nobody
It's
likes
good.
just their own bed all the time.
No, absolutely not. It's pretty lonely. Yeah. Yeah.
Well, here's how you contact the Snoring Center. Advent is located right on the corner of Highway 100 and Watertown Plank Road in Tosa. The phone number is 414-771-6780. You can contact advent.md online. Don't end up like Katie Holmes and Tom Cruise. Fix it.
Thank you so much.
Thank you very
Good
much.
to see you.
And up next, these jewelers.